Orlistat is a drug designed to treat obesity. It is marketed as a prescription drug under the trade name Xenical by Roche in most countries. Its primary function is preventing the absorption of fats from the human diet by acting as a lipase inhibitor, thereby reducing caloric intake. It is intended for use in conjunction with a healthcare provider's supervised reduced-calorie diet. Orlistat is the saturated derivative of lipstatin, a potent natural inhibitor of pancreatic lipases isolated from the bacterium Streptomyces toxitrescens. However, due to its relative simplicity and stability, Orlistat was chosen over lipstatin for development as an anti-obesity drug. The effectiveness of Orlistat in promoting weight loss is definite but modest. Pooled data from clinical trials suggest that people given Orlistat in addition to lifestyle modifications, such as diet and exercise, lose about 2 to 3 kilograms more than those not taking the drug over the course of a year. Orlistat also modestly reduces blood pressure and appears to prevent the onset of type 2 diabetes, whether from the weight loss itself or other effects. It reduces the incidence of diabetes type 2 in people who are obese around the same amount that lifestyle changes do. Benefits aside, however, Orlistat is noted for its gastrointestinal side effects, sometimes referred to as treatment effects, which can include stearia, oily, loose stools. They decrease with time, however, and are the most frequently reported adverse effects of the drug. Medical uses. Orlistat is used for the treatment of obesity. The amount of weight loss achieved with Orlistat varies. In one-year clinical trials, between 35.5% and 54.8% of subjects achieved a 5% or greater decrease in body mass, although not all of this mass was necessarily fat. Between 16.4% and 24.8% achieved at least a 10% decrease in body fat. After Orlistat was stopped, a significant number of subjects regained weight, up to 35% of the weight they had lost. It reduces the incidence of diabetes type 2 in people who are obese around the same amount that lifestyle changes do. Long-term use of Orlistat also leads to a very modest reduction in blood pressure. Counterfeit products. In January 2010, the U.S. Food and Drug Administration issued an alert stating that some counterfeit versions of Ali sold over the internet contained no Orlistat, and instead contained the weight loss drug sibutramine. The concentration of sibutramine in these counterfeit products is at least twice the amount recommended for weight loss. Orlistat works by inhibiting gastric and pancreatic lipases, the enzymes that break down triglycerides in the intestine. When lipase activity is blocked, triglycerides from the diet are not hydrolyzed into absorbable free fatty acids, and instead are excreted unchanged. Only trace amounts of Orlistat are absorbed systemically. The primary effect is local lipase inhibition within the GI tract after an oral dose. The primary route of elimination is through the feces. At the standard prescription dose of 120 mg 3 times daily, before meals, Orlistat prevents approximately 30% of dietary fat from being absorbed. Higher doses do not produce more potent effects. Generic Orlistat is available in India under the brands Orlin or Ris, Bifat, Orlistat, Abella, Orlica, and Reshape.